CIrrhosis by Sam Zorn. When a person has cirrhosis, their liver is slowly deteriorating due to chronic injury or long-term disease. Scar tissue replaces healthy liver tissue, which partially blocks the blood flow through the liver. Scarring not only blocks the flow of blood, but impairs the liver's ability to control infections, remove bacteria and toxins from the blood, and make proteins that regulate blood clotting. A healthy liver is able to regenerate its cells when they become damaged, but with cirrhosis, the liver is not able to replace damaged cells. Although cirrhosis is the 12th leading cause of death by disease, with 27,000 deaths a year, early treatment can control the symptoms and keep the condition from getting worse. There are many different causes of cirrhosis, alcohol-related liver disease being the most prominent. Heavy alcohol consumption over several years can cause chronic injury to the liver. For women, drinking 2 or 3 drinks a day for a few years can cause severe damage, and for men, 3 to 4 drinks. Autoimmune hepatitis is another cause of cirrhosis. It is caused by the body's immune system attacking liver cells and causing inflammation, which in turn leads to cirrhosis. Diseases that damage bile ducts are also a main cause. These diseases cause bile to back up in the liver, leading to cirrhosis. In adults, the most common condition is primary biliary cirrhosis, a disease in which the bile ducts become inflamed and eventually disappear. In infants, damaged bile ducts are often caused by Alagille syndrome. Inherited diseases, such as cystic fibrosis, hemochromatosis, and Wilson disease, interfere with how the liver produces, processes, and stores enzymes and other substances within the body. Cirrhosis can result from these conditions. It is common for people with cirrhosis to have no symptoms in the early stages of the disease. However, as it progresses, a person could experience some of the following symptoms: weakness, fatigue, loss of appetite, nausea, vomiting, weight loss, itching, and abdominal pain. As cirrhosis gets worse, a person may feel tired or weak, lose their appetite, feel sick to their stomach, lose weight, or notice red, spider-shaped blood vessels under their skin. Cirrhosis can lead to other serious problems, like bruising or bleeding easily, blood pressure increasing in the vein entering the liver, called portal hypertension, enlarged veins, called varices, developing in the esophagus and stomach, jaundice, or the development of gallstones. The basis of the diagnosis for cirrhosis is the presence of a risk factor, such as alcohol consumption or obesity. This basis is confirmed by physical examination, blood tests, and imaging. After asking about a patient's medical history and symptoms, the doctor will perform a thorough examination, such as an examination done on the liver, which will typically feel enlarged. In order to view the liver more accurately, the doctor may order a CT scan, ultrasound, MRI, liver scan, or even by inserting a laparoscope into the abdomen. A liver biopsy is not always necessary, but may confirm the diagnosis of cirrhosis. It will be performed with a needle inserted between the ribs or into a vein in the neck. A small liver tissue sample is examined with a microscope to look for scarring or other signs of cirrhosis. The treatment for cirrhosis depends on the cause of the disease. The intent of treatment is to slow the progression of scar tissue in the liver and treat the complications of cirrhosis. Depending on the severity of the disease, hospitalization may be necessary. The majority of treatment plans for cirrhosis are just lifestyle changes, such as eating a nutritious diet. A healthy diet is important in all stages of cirrhosis. A person with cirrhosis should not eat raw shellfish because they can contain a bacterium that causes serious infection. To improve overall nutrition, the doctor may prescribe a liquid supplement taken by mouth or through a nostalgic tube. Another lifestyle change is avoiding alcohol and other substances, both of which will cause more liver damage. Over-the-counter medicine should be cleared by a doctor before they are taken. If a person has portal hypertension, the doctor may prescribe a beta blocker or nitrate. Beta blockers can lower the pressure in the varices and reduce the risk of bleeding. The doctor may also perform a band ligation to compress the varices and stop the bleeding. Other treatments address the specific causes of cirrhosis, and separate medications are given to treat the symptoms of cirrhosis, like itching or abdominal pain. Cirrhosis is caused by the scarring of the liver, and once it develops, it is not possible to heal the liver or make it function normally again. It is a serious condition that leads to many complications. a hepatologist can evaluate and manage the complications involved in cirrhosis. In many cases, cirrhosis results in the need for a liver transplant. However, researchers are always studying new healing processes, and they hope to determine a mechanism in which scarring can be interrupted or reversed. Newer treatments for viral liver disease are being developed to prevent the progression to cirrhosis. There is hope that in the near future, the number of deaths by cirrhosis will decrease significantly.